Today we're going to be busting some myths about eye health and refractive surgery in particular. So myth number one, often I've had patients say refractive surgery is too risky and I'm going to lose my vision. That is not true. Every operation that we do in our eyes can have risk to vision loss, and that is true for refractive surgery. But most of the time, 98% of the time, we improve vision and we do not cause vision loss. There are some risks that you need to be aware of, but we go through that with you. And it certainly is not true you're going to lose your vision by having refractive surgery. So let's talk about myth number two. You are too young or too old to have refractive surgery. That is, again, not true. We expect you to be an adult with stable prescription to have the refractive surgery. So anywhere between 18 plus to 70 odd can have refractive surgery. Not necessarily on the cornea, but they can have it on the lens. So it's certainly not true at all that you're too old to have refractive surgery or too young. So let's look at the myth number three. So there is no risk to glasses. People think, patients and some ophthalmologists and some surgeons as well think there's no risk to glasses. That is certainly not true. So glasses are a foreign body that you put on your face, and you're walking about, you're active, you're playing sports, or you're walking down the stairs. You can have a fall, and that glass can shatter and injure your eyes. This is especially true for very focal lenses because they have different aspects of the lens doing different distance of vision. So again, glasses do have their own risk associated with it. So another myth is contact lens, again, doesn't have that much risk compared to refractive surgery. That is, again, not true. Contact lenses are foreign material that you're putting in your eye every day, and it carries its own risk, especially risk of infection that can cause devastating vision loss. So contact lenses are very comfortable, and people are used to wearing it for long hours during the day. And we advocate that you do not wear contact lens for more than 8 hours. You need to let the eyes breathe. You shouldn't wear the contact lens in shower. You shouldn't sleep with them in, and you shouldn't certainly go swimming with them on. The reason for this is our water has things like parasites like acanthamoeba, which can cause devastating infection and vision loss in the eye, and is excruciatingly painful. So it's certainly not true contact lens doesn't have any risk or little risk. So now the last myth we're going to bust is that refractive surgery is too expensive. That is, again, not true. So if you imagine someone who is in glasses or contact lens is going to be wearing them for decades. So they start in their teens or their 20s, and they're going to go into their 70s and 80s wearing glasses and contact lens. So if you add up all those costs of updating your lenses, updating your glasses, refractive surgery is very economical and sustainable from that aspect, and is certainly not too expensive. So thank you for listening to me, and hopefully we've busted all those myths.